Unit 4. Unit 4, how to use CPR and AED. Number 1, diagnosis versus prognosis. So, diagnosis is when the doctor listens to the patient or checks the patient and then decides what's wrong with the patient, what the problem is. So for example, a doctor could say that maybe an old man has cancer. That's the diagnosis. Okay, the prognosis is what will happen, what will probably happen after the diagnosis. So, for example, if a doctor says to an old man, the diagnosis is cancer, the prognosis is, you have a 50% chance of living if you do the treatment. So the prognosis is what will happen to the patient after the diagnosis. Will they get better? Will they not get better? Will they live? Will they die? Like this. Prognosis. Number 2, electronic versus electric. This is very difficult because sometimes electronic and electric mean the same thing. Electronic is usually we usually use electronic for some device, like a cell phone. We would say that it's an electronic device. So electronic is usually used for something, a device that's small to describe it. Electric is usually used to describe a bigger machine or an old-fashioned machine. But again, sometimes they are the same. But for the AED, an AED or a defibrillator is an electronic device. It can give someone an electric shock. So an electric shock because there is some electricity. Okay, a defibrillator is an electronic device. It can give a patient an electric shock. Number 3, external versus internal. This is very easy. External just means outside, and internal means inside. So sometimes at a hospital, there are different departments, so external medicine or internal medicine. So it just means, external just means outside or about the outside. Internal means inside or about the inside.